The title of our project is A Stepwise Approach to Advanced Care Planning at Maplewood Manor. Our aim is to ensure that 100% of nursing home residents at Maplewood Manor have an up-to-date and accurate Advanced Care Directive, ACD, that adequately reflects their wishes for end-of-life care. A couple quick definitions. Advanced care planning is the process that helps adults identify their personal values, life goals, and preferences regarding future medical care in the event they do not have the capacity to do so in the future. Advanced care directives are legal documents stating the patient's desires regarding medical care if they become incapacitated or unable to speak for themselves. ACP preferences help guide ACDs. Advanced care planning is an important process for adults of all ages, but especially for nursing home residents. The current low rates of ACDs present a challenge for providers when residents face serious life-threatening conditions. This is especially true in the midst of the coronavirus pandemic. There are several constraints that limit nursing homes from completing and updating ACDs, including low staffing, the lack of ACP training, and the inherent difficulty of having such conversations. In the midst of the pandemic, unique problems arise, largely stemming from decreased access to family members and surrogate decision makers. Intervention. Our plan to improve ACD rates in Maplewood is a multi-step process. First, we will implement training for staff members for ACP conversations with patients. Staff will complete a free online ACP course from the CDC that addresses barriers and strategies to approach this difficult topic with patients. They will then complete a Zoom role-playing session hosted by the medical director to practice these skills. Staff will complete the online course and role-playing from home and will receive continuing education credit for both sessions. The next step in the plan is to assess decision-making capacity in our residents. Residents coming from a hospital will be required to have their capacity assessed by a hospitalist prior to discharge. All current residents and incoming residents not coming from a hospital setting must be evaluated by our in-house medical director or physicians. The next step is ensuring family involvement. After identifying patients who lack an ACD, nursing home administration will use input from the resident and family members to identify the stakeholders involved. A time and date will be set up for all parties to discuss the resident's desires. Decision aid videos will be emailed to family members prior to the ACP conversation. The next step is facilitation of the ACP conversation, led by our trained staff in the patient's rooms using proper PPE and social distancing. At the request of the resident, family members can be present via video chat or speakerphone. The ACP conversation will be focused on what matters most to the resident and how much medical intervention he or she would want. Decision aid videos will be displayed on iPads demonstrating CPR, intubation, feeding tubes, and ICU stays to help the resident make these decisions. Google Live Transcribe will be installed on each iPad for talk-to-text transcription for hearing-impaired residents. A completed ACD form will be the product of each ACP conversation. Copies of these forms will be kept by the facility, uploaded to the nursing home server, given to the resident and to the resident's family. In order to ensure ACDs reflect the resident's most current wishes, annual updates will be required. Notification systems will be used to alert staff when a resident's ACD is expiring so that residents and families can be reached to discuss changes in their desires, if any. Implementation. When implementing our stepwise intervention, nurses and physicians will facilitate discussions with the residents regarding advanced care planning. As previously mentioned, educational videos help to guide an informed discussion with patients and their families. Residents and their families can view the videos at their own pace and have the time and privacy to discuss any concerns with their healthcare provider. Our quality improvement goals involve assessing our success at achieving our goal of documenting 100% of ACDs for our nursing home residents after 1 year. We will track our progress through quarterly evaluations over the first year of implementing our plan to analyze the proportion of all residents that have completed advanced care directives. We will also be distributing surveys before and after the intervention to assess the stakeholders' experience in completing an ACD, as well as the comfort level of staff in initiating and completing advanced care planning. Discussion. This intervention provides some key benefits. First, the intervention emphasizes early implementation of ACP, which allows for ample discussions between all stakeholders. Second, standardized documentation ensures a universal record of patient wishes. Third, scheduled updates ensure ACP plans that grow with the patient's wishes. Last, the provided staff training will give residents the comfort and guidance required to think through their end-of-life goals. There are a few potential barriers to successful implementation. For example, there may be limitations in resident access and comfort with the technology used. Additionally, visual and hearing impairments may prevent patients from reading or watching videos. To facilitate conversation with the hard of hearing residents, a few steps will be taken. Personal amplifiers will be available, clear face masks will be used when possible, and live transcription will be available. Google Live Transcribe is a free Android app that transcribes conversation as it happens with adjustable letter size for the visually impaired. After implementation of this intervention, it would be beneficial to assess challenges encountered by staff in carrying out these conversations and address factors that inhibit documentation of ACDs.